name's Amy Maloli. I'm a certified hand therapist and occupational therapist here at the Hand Center at Muskegon Surgical Associates. Today I would like to talk to you about the therapy process after a flexor tendon repair. Flexor tendons help us bend our fingers. We have two tendons for each finger. One tendon goes to our middle joint and the next tendon goes to our tip. And unfortunately, when we tear or rupture a tendon, the only way to fix that is through surgery. The hardest part with tendons is if we move them too much, that repair is going to separate. But if we don't move them enough, we're going to form scar on that tendon and it's going to get stuck. So our job in therapy is to get you moving just enough to keep that tendon moving, but not to rupture it. So when you come into therapy, we like to see you about 2 to 3 days after surgery. And at that point, you're coming with your big post-op dressing still on. So we ask that you don't remove that dressing until you come see us in therapy. We don't want you wiggling your fingers in that dressing or anything. That dressing is purely to help get all that swelling down and help things calm down. When you come to therapy that first day, we're going to unwrap all of that dressing. We'll wash it up, make sure everything looks good, and then we'll do an initial assessment. We're going to measure how your swelling is, how your sensation is, and get you moving a little bit. So it's important before you come to that first appointment that you eat before you come, and then if you're having pain that you take some pain medication. You would be surprised after you take that initial dressing off. Sometimes people might get a little woozy, and by having something to eat, it just makes that session go a little bit better. So also in that first session, we're going to make you a custom thermoplastic splint. And that splint looks like this. This splint is important because it will help you protect that repair. So what we're going to do is you put it on like this. And it helps keep that tendon in a protected position. So if you fall, you're not falling on a stretched hand that's going to rupture that repair. The splint also gives you a very nice surface to do your exercises on. Okay? So you can bend your fingers within your splint. As we keep progressing in therapy, we will cut the splint down. So the splint will start to get smaller. We'll do this at about 3 weeks from surgery. Okay, it still gives you that protection, but it allows you to move your wrist, which is going to help you move those tendons a little bit more. The normal process in therapy is 2 to 3 times a week for therapy. Normal plans of care go for about 8 to 12 weeks from surgery. Part of that does depend on what kind of work you need to get back to and the demands that you place on your hand. Every hand and every injury is a little different. So what I've gone over today is a general recap of what you should expect in therapy. If there's a nerve injury or a broken bone along with your tendon injury, your path might be a little bit different. If you have any questions before your surgery or after your surgery, please feel free to contact us at the Hand Center here at 231-246-2440.